Hi everyone, today I wanted to speak about something that I believe is crucial in midwifery, and that is humanising birth. As future midwives, it has become more and more evident to me that we have a unique role in facilitating birth as the very normal physiological experience that it is, and by focusing on compassionate, individualised support rather than routine medical procedures, we are able to truly provide care that is safe and considerate of all women. The purpose of this presentation is to explore what humanising birth truly means, why it matters, and how small, respectful actions can have a profound impact on women's birth experiences. When it comes to humanising birth, it is always more than just the outcome. It's about the experience. It involves treating women with dignity and providing individualised care that ensures their voices are heard and respected at every step. In a system that often leans heavily toward medicalisation and protocol, it can be easy to overlook the person at the centre of it all. I've observed in my clinical practice that one of the most powerful ways we can challenge this dehumanising outlook is by upholding a woman's dignity throughout the entire process. Dignity isn't just about politeness or kindness, it's about recognising that the woman giving birth is the most vulnerable person in that room, and she deserves privacy and to be involved in her own decision making. It's about understanding that she is not just a patient or a case, but a woman with her own values, preferences and emotions, and a right to be heard. There have been multiple times now on placement where during a birth a woman has had some tearing or is needing some additional care, and a doctor has come into the room and reflexively reached for the stirrups. I can think of one occasion in particular where the woman was not even asked if she was okay with her legs in stirrups, and I could see the position made her visibly uncomfortable. It showed me how easily dignity can be compromised in these moments from a lack of humanised care. As a student, I couldn't necessarily stop the decision to suture in stirrups, but I could stay by her side. So that's what I did, and as I talked her through everything that was happening, I could see that she became grounded and was able to focus purely on her baby. This reinforced with me that birth is not just clinical, but an emotional and life-altering experience for women, and it is our role as midwives to help protect that. Going off this, humanising birth is also about questioning the overuse of interventions. While interventions can be crucial when necessary, their unnecessary use can undermine women's confidence and interfere with the natural process of birth. Promoting normal birth means creating confidence that supports physiology. As midwives, we can advocate for this by encouraging mobility, informed choices, and calm, uninterrupted environments. Another key way we can help limit the overuse of interventions is through continuity of care. It has been stated by the Australian College of Midwives that when women are supported by the same midwife throughout their pregnancy, labour and birth, they build trusting relationships that allow them to feel more in control and more likely to express their needs and preferences. It also gives us as midwives a deeper understanding of their values, their health history and what's normal for them. So we're less likely to default to unnecessary medicalisation out of uncertainty. Not to mention, when we truly know the person we are caring for, we are far less likely to treat them as just another patient or subconsciously diminish their emotional needs. Instead, we are reminded of their individuality, and this helps prevent the kind of dehumanising care that impacts autonomy and influences the overuse of intervention. At its core, I believe humanising birth is about showing up, not as passive participants of a clinical workplace, but as guardians of one of life's most profound moments. This module has allowed me to reflect on the importance of humanising birth, and it is something I have become more and more conscious of whilst on placement, as I strive to uphold dignity and protect physiology. I also believe this module has made me grateful for my continuity of care experiences, as I've become more aware of the differences my professional relationships in continuity of care have had on women's pregnancy journey and birth experience.